Hello and welcome back to my channel. Today I'd like to reflect on advanced care planning, which is an aspect of care that we provide to patients whom we have classified as frail. And this framework helps us to put the power back into the hands of our patients to decide or have an idea of how they want to be cared for when things are no longer as they used to be, particularly when their health is deteriorating. It affords us an opportunity to have a robust conversation around care needs, as well as provisions that can be put in place to assist these patients meet those needs in a place where they feel is most suitable to them. Today, I wanted to share the clinical aspect of how we look at prognosticating certain chronic diseases, which might be the initial way of identifying patients that might benefit from advanced care planning. And if you look at the chart behind me, we've set up a graph that stipulates different diseases and how they might impact the individual's function over a period of time. And this chart is particularly important because it can inform when it's suitable to bring patients in to have these conversations, when there is a new diagnosis that we think is going to significantly impact the patient's levels of function, when we have noticed the patient is possibly in the end of life. These are all scenarios that can trigger an assessment or a conversation with the patient about advanced care planning. So I'll go through 4 of them. So the first one here is an acute illness, and most people will have high function until something catastrophic happens, for example, sepsis, and they require immediate hospitalization, and that leaves them in hospital for a pretty long time. This is true for frail individuals whose capacity to resolve acute issues have reduced over time. Another significant illness can be cancer diagnosis. Cancer is a very debilitating condition, and whilst most people might maintain a strong function for a long time, they might suddenly deteriorate and go into a phase of end of life. Much more slowly, but equally important, are organ failure related chronic conditions. In this graph, you can see how undulating, but slowly but surely, the individual function of the patient gradually declines until their end of life. Similarly, with a much more lower level of function due to frailty, frail individuals go up and down on that lower level of function as they approach the end of life. This gives us a prognostic tool to help us initiate conversations for patients who we think might be frail. So in my next video, I want to be discussing how to perform advanced care planning and the type of interaction that I've had with patients that has facilitated this conversation to be very productive. So see you in the next video.